Okay. All right. Hi, everyone. Thank you so much for joining us. I'm Jen Schonger from the New Jersey Autism Center of Excellence, the NJACE, which is funded in part by the New Jersey Governor's Council and the New Jersey Department of Health. Today's webinar is with 3 wonderful OTs from Children's Specialized Hospital. First, we have Joanne Hunt, who's been practicing OT in pediatrics for over 30 years. She's been an employee of Children's Specialized for a total of 27 years and currently holds the position of clinical lead for occupational therapy. Welcome, Joanne.
Thank you.
Then we have Patricia Fowler, known as Patty, who received her degree in Doctor of Occupational Therapy from Thomas Jefferson University in Philadelphia, PA. I should also note that Joanne also has a Doctor of OT. And Patty has been working as a pediatric occupational therapist for 28 years. Patty has worked in a variety of settings, including private practice, school-based, early intervention, outpatient clinic, and currently works at Children's Specialized Hospital in Toms River. Welcome, Patty.
Thanks.
Next up, we have one of my favorite people, Regina Freeman, who is an occupational therapist with over 20 years of experience. She's currently a supervisor of pediatric occupational therapy at Children's Specialized Hospital in Toms River as well. And she is also the clinical liaison for us here at the NJACE. So welcome to all of you.
Thank you.
Okay, so I just have a couple brief housekeeping notes before we get started. We are live on YouTube right now. The recording will be available to watch anytime after this. And the YouTube version will have both Spanish and English captions, probably within the next 48 hours or so. Our OTs would love to answer any questions that you may have, so please feel free to ask away. If you will need to be logged into the YouTube, into your YouTube profile to ask a question, and just post in the chat as you have them. If you do have a question that you would prefer to keep anonymous, you can feel free to email me. I will keep your question anonymous and I will just read it. My email address is jschonger@njace.us. We can probably put that into the chat in case anyone needs it. And as always, we would love to hear more about you. So if you're comfortable, please feel free to let us know a little bit about yourself in the chat. So I was thinking a lot of people are not really quite sure what an occupational therapist is or what you do. So maybe Gina, you could start us out by explaining to us what it is that you all do and how do you help people?
Sure, sounds good. So in pediatric occupational therapy, we're really looking at how we can help the kids that we work with get as much potential out of their daily life as possible. So what does a kid do in their day-to-day? Kids eat, they sleep, they go to daycare or they go to school. Important in their life is being able to go out to the grocery store with mom, see family on the weekend, go to the playground, play with their friends, participate in school. And as they get a little older, some of those challenges increase. So the demands at school for learning increase. They have to pay attention for a little bit longer. The demands of playing with friends and making friends and being social and what else? They even to the point of taking a look at getting their first job. So we really take all of the functions of their day-to-day from early development, infancy, preschooler aged, and work that all the way through elementary school and adolescence. And what we're really trying to do is understand what's important for them. And then what they bring to the table as strengths. Then we have to put our detective hat on. And what we typically do is an evaluation. We help identify what is important with the child and the family. And then we use observations and standardized assessments. And we really figure out, what we could support them in. So very often when we're talking about an autistic child, things that are challenges for them come into play with their ability to regulate their body functions, their heart rate, their breath rate, their sleep cycles, their hunger cycles. That could expand through to their motor skills. That could expand to their visual perceptual skills. So we really sort of figure out what's important for them, what challenges they have, and put it all together, partner with them to make goals, and then really make it happen in our therapy clinics.
Thank you so much. So, okay, so another question that I would love for all of you to cover is, most of us know about the 5 senses. We have sight, sound, taste, touch, and what am I missing?
Did you say vision?
No.
Vision. Oh, yes. Okay.
Okay.
So, but we actually have 8 senses. So I don't know who would like to take this one, but could you explain the other 3 and just a little bit about each one?
Sure, I can start. So one of the senses that people don't necessarily think about is our proprioceptive sense. And that sense comes from receptors that are in our tendons, our joints, and our muscles. And it tells us how much force to use, how soft, how hard to push or pull. And it gives us a sense of body awareness. And then our other sense is our vestibular sense. And this system is housed, it's in our inner ear. And it's responsible for maintaining balance and posture and our body's orientation in space.
And then I think the last one that you're thinking of is interoception. So interoception is more of the sense of our physiological sense of our body. So our hunger, our thirst, sleep cycles, bowel and bladder control, and being aware of that. It's similar to the proprioceptive system, that it's an internal awareness. A lot of tactile and proprioceptive techniques are a little helpful for the interoception.
Yeah, and our interoception can also be, it also involves our moods and our emotional conditions too. So our ability to sort of detect that we're angry and to maybe interpret it as anger is also tied into that interoceptive system.
Yeah. And I have actually seen a lot of autistic adults talk about this sense in particular, with identifying the exact feelings that they may be experiencing, having that emotional regulation piece. And then it does also seem that temperature regulation also seems to be
Mhm.
one of the things that a lot of people experience differently. So do you, Gina, maybe you want to go next about leading us off with what is sensory regulation, and how does that affect our bodies?
Sure. So sensory regulation is really one of the foundational things that's important for us to start to interact with the world, or really to be a little bit at peace with ourselves. So straight from infancy and all the way through into adulthood, every minute of every day, our body works really hard to regulate itself. And the regulation that our body does happens in the middle of our brain. So we don't think about it. So I think that's one of the important things that we need to know about regulation is we can't will it to happen. Regulation happens as a neurophysiological response to our bodies and to our environment. So what does that mean exactly? What it means is that our body naturally has its sort of ups and downs and responds to things like sound in the environment, movement, our own body sense. So regulation is really our ability to control our heart rate, our breath rate, a little bit of controlling our activity level, and really is interactive with a lot of those physiological responses that our body sort of naturally does. So when we are good at regulating our bodies, we sort of naturally have like some ups and downs if we increase our movement, or if something gets us a little upset, we can easily kind of be up a little bit and then sort of calm back down. For children that we work with whose system is, it's hard for them to regulate, can really have a hard time when any part of their regulation is challenged. And then often it takes time for them to settle that out. And self-regulation is one of the foundational things that we try to identify when we work with autistic children, because a little goes a long way in that area. If they could stay in a little bit of a better place managing their own body and their own system, a lot then naturally happens in their ability to learn and play and do and be.
Yeah. Okay, thank you so much. Okay, so then speaking of that, many people on the spectrum describe difficulty with being able to, first of all, a lot of people experience meltdowns due to, demands exceeding their ability to respond in the moment. Many people talk about how the meltdowns actually are not caused by what was immediately preceding it, but kind of like a buildup of cumulative stress. So what are some signs that like parents should look for, or educators, or anyone who's interacting with kids? What are some signs that people could look for to kind of see that some dysregulation is happening?
It's going to be different for everybody is one thing, because we all show signs differently, but dysregulation can be anything from, what we know as meltdowns. It can be avoidance techniques where kids will run away from things. Some people will actually become silly rather than in a destructive way. They become overly silly and disorganized. They don't know what to do next. They can't really gather themselves together to be able to engage in any functional manner because they can't pull themselves together. So it's really different for everybody. I think most people think of it as meltdowns, but it's not always the meltdowns.
Yeah, and sometimes it can be really subtle too. You may have that child that might be in circle time or in an activity with some peers, and the teacher may find that that child keeps just walking away, and then they're directing that child back, and the child keeps walking away and directing them back. So you almost want to watch out for some subtle things like that, because that behavior is telling you something right there. That child's having a hard time being in that activity and they're moving away for a reason, so it could be, just turning away, putting the head down, turning their back, even, physically removing themselves from an area. That could be signs as well.
Yeah.
I
I've
think-
also, go ahead.
I think it's important. A lot of the tagline for self-regulation comes to that fight, flight, freeze.
Mhm.
So those are big words that you hear, and tuning into that, like you all said, is sort of important, and it's different for everybody. But so one kid's flight may be removing themselves from the activity, and giving them a little space and a little time may net you more than the constant redirections. So just allowing a little bit of time, and then, bringing them back after a short break may net you. The fight part is pretty obvious, but the fight part often has signs leading up to it, and tuning into heart rate and breath rate is really important in that time, because you may see a subtle change. You may see changes in their eye gaze or changes in their posture. Those could be little signs that you could give the child a break before the fight comes, if possible. It's not always possible. And then the freeze part, kind of relates to the shutdown piece. And again, if this child is starting to shut down, giving them that break and the time may prevent the some of that from gaining intensity. So
Yeah, a lot of people talk about how once they kind of get to that point of dysregulation, it's so much harder to recover from that than if you're just being proactive and like realizing the signs like before it gets to that point. And I feel like that's something like even all of us kind of can relate to. It's like, once you've kind of lost your cool, like it's going to take you a lot longer to be able to get back to like a regulated state. And one thing that like Dr. Torres has talked about this before too, and with the she qualifies it as motor noise in the nervous system in autistic people, but it's if you're like all of us, I'm sure if we're like driving somewhere and you're not sure where you're going, like you end up turning the radio down, and most people have no idea like why they're actually doing that, but it's because they're trying to tune into where they're going, and their visual sense needs to be on more alert. And a lot of the struggle that people on the spectrum have is that they can't necessarily turn down their senses, and it's just too much. And so, clearly we can do a lot to either help or potentially go the other way if we aren't aware of that. Okay, so I actually wanted to get to the next question if we could. So we have a question from Marge Blanc, who commented on our Facebook page before we started. Marge is an SLP who works in a center. And so this is what Marge says. I guess one question would be about a discussion to help us understand the need for vestibular input and how to put OT vestibular recommendations into practice outside the OT clinic. So what do you all have to say about that? Who wants to go first?
I'll go. So a little bit about the vestibular system. The vestibular system sensors live in our inner ear, and whenever we're moving our head in space, our brain is getting information through our vestibular system to say, Are we moving? Are we not? Are we going straight? Are we turning around? Is our head upright? Is it upside down? And all of that coordinates with our eyes, with our postural system, with our balance. And so it really is like the GPS of our head. And it's important in understanding our body. And then it's important in controlling our body, and then lays the foundation so that we could be centered and then do things with the environment or with other people. So in communication, which is important during speech therapy and in other aspects of life, this is a foundational piece. So, giving the body a little bit of movement opportunity helps that vestibular system get a little bit more information. So one of the things that's a little bit hard to understand, but is important, is every single person's body has registers our sense information a little bit differently. So sometimes autistic kids need a little bit more of that sensation to come in for it to hit the nervous system and they can make sense out of it. So it's sometimes it's hard to get movement activities involved when you're trying to do a cognitive or an attention task, or to do some of the prerequisites that you're looking for when it relates to building language skills. But taking those activities and bringing them into a more child-friendly environment, like a playground activity, or in an open space where they can move around a little bit and access toys and have a little bit more of a ability to even seek out a little bit of what their own body needs, could be helpful. But some preparatory tasks that are sort of go-to for OTs are log rolling, jumping, doing upside down and right side up. What else? Even, if you have the luxury of having swings, in your school or at the playground. What are some of our other go-to vestibular things?
Like helicopter, like spinning yourself around and freeze.
Oh, yeah.
Yeah, and then going both directions, making sure your head's going in both directions.
Yeah, doing the windmills. Yeah, bending down, making sure you got that change in head position, and yeah.
Even some like running with direction changes is good. Like you could incorporate finding items in the room, running over to this item in the room and getting it, and then coming back and talking about it, or hiding something under the chair so they have to look under it and look down and then pop up. Maybe activity cards. What else?
Would like going on a scooter or something.
Mhm.
Oh yeah,
Because I know a lot of schools have scooters too.
Yeah.
So
yeah.
okay.
Yeah, scooters are great because you can sit on the scooter, you can lay on your back on the scooter, you can lay on your stomach on the scooter. So they're pretty versatile.
Yeah.
For homes, there's even the office chair. The kids can spin themselves. You can do silly games with spinning and then having to find something, looking around. You just have to be cautious with a lot of rotary movement. You don't want to have someone get an over response and get sick or become disorganized, because you can very easily become disorganized with too much input.
Right. And I think you saying that actually reminds me, because I just think that this is like an important thing for people to keep in mind. Like, so people on the spectrum have a lot of sensory differences, some that are too sensitive, some that might be hyposensitive, but it's not just things that are like off. They actually have a lot of sensory gifts as well, and things that seem to help them, have better acuity than a lot of neurotypical people. And I like to remind people of that, because I know, like, when my daughter was young, it helped me so much to like think about that in that way. And I know, like, that's, you all like put things in such a nice perspective for people. Okay, so I think we actually have another question that someone emailed to me. So let's see here. Okay, so my daughter is 7, and it's always been an issue to clean her after she goes to the bathroom. She will not allow you to, or she tightens up so that you can't. What can we do, or what help can she get to help her with this? She also won't raise her arm up all the way to put deodorant on, and I don't understand why. Is this a sensory thing, and what can we do? So this is more of like a, in detail question. If you need me to read any of it again, let me know.
No, good question. And again, it's going back to trying to understand the why behind what's happening. So, are there differences with this child in her tactile system and the feel of the toilet paper, or even the feel of shifting her weight to the side? Is that, something that's causing her distress, and that she's avoiding having that happen? With the deodorant, is it the sensation from the deodorant? Is it a roll-on? Is it a stick? Is it hard? Is it cold? How is that feeling? In terms of
maybe even the smell.
Absolutely. Even the smell of the deodorant, to avoid that. So it would be good to do some good detective work and try to really figure out, what's the underlying reason, for her responses.
Yeah.
And then to go from there.
That's really good advice. So speaking of toileting, because this is obviously something that a lot of parents especially, are concerned with, and many, I don't think there's a ton of research about this yet, but from hearing from adults, it seems like a lot of autistic people just, are on more of a delay, which is totally fine. It's their development. But interoception would play a role in toileting, as well as, all the things you mentioned, Joanne. And even the way I didn't even think of, shifting weight, but that might have to do with tone and things like that, right? So what are things to look for? Like, how do you know a child might be ready? Like, how do you introduce them to it? Obviously, then communication is another layer there, because maybe they can't say as easily if they need to go. Maybe they can't open the doorknob by themselves. Like, there's a whole array of factors here. And I know this is like a totally complex, like, layered thing, but, this is why you are all here, and this is why this is so amazing. So, I don't know where to start on that, but, yeah.
Well, it could run the gamut of everything and anything that we could look at as OTs, so one, is it the interoception sense? Is this child not adequately sending signals from the bladder, or receiving them, or even like recognizing that you've got those signals going there. So it could definitely be related to that eighth system. Are there other sensory integration problems going on? A lot of times, again, it is that tactile system. There's a lot of sensations you feel, when you're sitting on the toilet. There's the toilet seat, you don't have your underwear on, your skin's on this, so there's so many cold, right? There's so many sensory factors that are going along with it, as well as that postural control component too. Can they manage, the stand to sit and the sit to stand, and the balance, maintaining a sitting balance on top of the toilet. So there's a lot that goes into it.
So what do people do if their child needs help in this area? Do they go to an OT, and do you actually are you doing toileting activities? Like, not toileting activities, but are you are there other activities that you do to help support that? Like, is there anything people can do at home? Gina, you're shaking your head, so
yeah. So when it's time to do potty training, it's always a complex sort of ordeal. And then when you add on some of the other challenges, the best thing really to do is to start somewhere and then add to it. So most of the time, autistic kids have the sensation challenges, the postural challenges, and the breath support challenges. We sort of know that. But they also really, really do well with visual cues, keeping it structured, and making patterns. So, sorry, my thing logged off. Hold on. Ooh. I'll keep talking. I'm going to try to talk and do this at the same time. So you could kind of use some of those strengths to help you out. So if your child is successful at sitting with you and reading a story, they have a few minutes of attention. So a few minutes of attention to potentially transition to sit on the toilet. So making a picture of the potty and the book, pairing them together, making it happen at a similar time, right when you wake up, right after school, right before bed, and not having a lot of expectation of anything that's going to happen on that potty, except for go in there and have a little story time and then set that foundation. Within that, you then want to support their postural system and they're feeling secure. Yeah. So put a stool in there, let their feet be, on the stool. In the beginning, if they want to sit on the potty and have a story, feet on the stool with their clothes on, let that happen. Layer in the demands as you go so that it's baby steps towards getting the job done. And then, when you really are struggling, it's definitely a self-care area that can be addressed in OT. We could work on the sensory factors, we could work on the strengthening factors, and combining that postural control, breath support, and muscle strength. And working on both of those things together really has a good foundation for that.
I know for me, I have a lot of kids that I work on grasping, like first getting the toilet paper and grasping it. They don't really always have the stability in their hands because of lower tone, hypermobility, whatever different reasons. So besides working on fine motor strengthening, we actually work on grasping things and actually reaching behind, being able to get the range of motion to get where they need to. And a lot of times they don't have great body awareness, so they're not even aware of their back selves. So again, bringing back into that tactile body awareness, working a lot of sensory things in preparatory of the tasks are really helpful.
Yeah. Okay, that's wonderful. Go ahead.
And there's some things just in terms of addressing that interoceptive part of it. Depending on the age of the child, but you can sort of start doing things sort of like mindfulness kind of activities. So, while you're sitting on the potty and you're reading that story, start sort of talking in about tuning in, what's the sensation you're feeling right now? What do your feet feel like? What does your stomach feel like? So that they can start working on being in tune to those subtle sensations that they're getting from the inside of their body and their organs too.
Yeah, that's really helpful. I just read recently too that it's like the more that we can model that language about ourselves and how we feel too, like it kind of helps, give them the words to do that. Okay, so this is great. Okay, I'm going to move on to another question. Actually, before we do that, since we were kind of talking about tone and breath, because I feel like this is another area that a lot of people are not quite aware of with regard to tone and autism. How does having low tone affect your body? And like Gina, you and I have talked about tone and breath and, obviously speech and things like that. But it also has to do with regulation, like you all kind of alluded to earlier is, if your breath isn't regulated, that's going to kind of dysregulate the rest of your system. So tell us about tone.
Sure. So I'll start, and you guys could chime in. So tone basically is your steady state of like muscle stiffness. Everybody has a variety of different muscle tone. Some people have lower tone, which means they have to generate a little bit more force when they need to get their muscles working. Some people have higher tone, where you kind of like, sometimes they have stiff shoulders or stiff bodies. The tone by itself can cause challenges. So if your tone is lower, it takes more oomph to sort of get your muscles going. It's not to say that they can't get going, but it takes a little bit more. Often when kids have lower tone, in therapies, PT and OT both, we get their body a little stronger so that in their general day-to-day, they're not having to generate as much oomph. They start with a little bit of a better starting point. I think the bigger picture is for us as healthcare professionals is to really help rule in or out when there are significant postural alignment issues that may be causing an individual to be at a disadvantage for having good breath support, meaning being able to take in an adequate volume in their inhale and their exhale. So often, if we miss some of that in early development, it looks like this. It looks like some kids have a little bit of a higher rib cage. Some kids have a little bit of an extended belly or an indented belly. What is happening is their whole abdominal muscle system isn't activated and working in sync with their rib cage muscles and their neck muscles and their back muscles. And so what's happening is there's sort of a mishmash of stiffness and looseness and strength. And then what's happening is they're very inefficient in breathing. So you see a lot of higher breath or uncoordinated breath. And so that person needs to take more breaths in a minute. If I'm taking more breaths in a minute, my breath rate is really fast, and that's not helpful for me to keep sort of a regulated, steady state of activity. I'm sort of like up and anxious, and it's hard for me to calm myself down because my breath rate is just too fast. So it's definitely something that should be observed and addressed, because a little could go a long way in helping the individual be able to calm themselves down using their breathing.
Yeah. And this is something that an OT would see in an evaluation, right?
Yeah. And we look at it both in OT and in PT and it also sometimes is picked up at the physician level, and they, refer to us to address that.
Right. So this is a physical or physiological difference that plays a huge role in regulation.
Yeah, and we find a bit of a pattern happening in OT. Often not only autistic children, but children with ADHD, some children with some learning issues. This is something that should definitely be observed and ruled in or ruled out, because the breath system, again, goes a long way. We could help we could help a lot by addressing this breath system.
Yeah.
A lot of kids are very fast breathers, so it just sets them up higher. In therapy, a lot of things we can do is we can use ourselves to help model. So just by breathing deeply and slowing our breath down, a lot of times, if you make it audible, the kids will kind of start to follow your breath system. And you can really help to bring them down. And that's something you can teach a parent, another friend, or anybody to kind of do to help bring down as well. It's pretty, it actually does work pretty nicely for a lot of kids.
Yeah.
Just really stop talking, just use your breath in an audible, loud way so they can start getting in that pattern, and really is really very helpful to calm.
Yeah, it's that concept of entrainment, so you're entraining the kids to your breathing pattern, to your breath. Sometimes you're having them sit right in front of you and just breathing along with them. And Patty said it really does work well.
Yeah, that's awesome. My daughter has a lot of motor planning challenges. And so she kind of needs to like see things, a lot of times before she can do it. And one of the ways that she has taught herself to do this is through watching her favorite cartoon characters. And so she'll rewind the part, watch it, do it along with them. And it, I always worried about this because it's like, for someone with these motor challenges, like it's so hard to be able to do these things that a lot of us take for granted. But I love what you said about like joining with them and like giving those models, because it really does seem to just click and make things easier.
Yeah, I think that's so important, and to watch and learn from what the child already does, and to wait long enough to really see and learn from them. So, it's such a great gift to just stand back and watch for a while and see, where they're going, what they're doing, where their curiosity lies. And it brings to mind two things. One is in showing through that visual system is the best tool that you could do. So using your body as a mirror and having them copy it, or even better, to do it with a fun, cool like character or another child, is really like, right up their alley. And the cool part about living in 2021 is you could find anything on the iPad. So, using those visual models is really just channeling the information in a way that they best understand it. And then their body responds. And then you could build on that a little bit more. And then their body responds. And then you can kind of keep building in on that. And then you can kind of join in, and then you could start to copy them. And then it becomes like an added thing. So, watching and learning from them, mirroring, joining, waiting, all of that is really key concepts that really, really work well, especially with autistic children.
Yeah, that's
I think
great.
sometimes waiting is a really important thing. I think we're very quick to jump in, pretty much in general, not even for autistic kids, but for a lot of our just typically developing kids too. We jump in and don't let them have to problem solve or get bored and try to figure out different ways to do things. The sitting back and watching is a great way to see what are they doing, and then how can you get in there and get into their play, give them some time and get them into your play also. So it kind of combines, but waiting is really big. We jump in pretty quickly, and they need to figure this out on their own as well. Like, we do need to provide the visual supports and all the supports, but we want to get that intrinsic motivation to want to keep motor planning and problem solving.
Yeah. Okay, so we actually have a question from our very own Joe Vero. So Joe says, maybe this is the wrong distinction to make, but to what extent is dysregulation an inability to regulate under typical conditions, as opposed to the conditions one experiences being far from typical. So then he explains further, is a dysregulated vestibular system due to the sensory input itself being perturbed, requiring adapted processing, or is it more likely a typical sensory input that is simply processed differently?
Ooh, that is an awesome question.
Yes.
So I think the best way to answer that question is to understand how the vestibular system works and where in the brain the information goes. It could be any of those things, but so the vestibular system movement registers in your inner ear. So if your body needs more information to register that information, then chances are it's not going to overly dysregulate you. If your body is responds more quickly to vestibular input, it could very much feel wonky to you. So you may be somebody who head movement and eye movement gets you disoriented visually. It could be where that information comes into your body and registers and makes you feel dizzy in day-to-day activities that wouldn't make another person feel dizzy. So if your head movement disorients you, or if movement in general elicits, sort of like yucky, dizzy feelings, then it could send you into a dysregulated state more easily. However, on the other end, your vestibular system could be calming and helpful. So often rhythmic movement can actually help the body calm down a little bit and offer you an opportunity for regulation. So it really sort of depends. And then there's always the idea that that sort of rhythmic calming motion can be helpful to you, but there's also the idea that proprioceptive sense can join into the party and help your overall regulation by getting your muscles to kind of work in a steady state sort of way, and helps your whole system calm down. Are there more specific examples that we could explain it better?
I think you did a really good job, but I think another piece of it, of what could happen dysregulation wise, is the difference between the passive providing someone with passive vestibular input versus them actively engaging in the vestibular input, where they're in more control. We learn better, our bodies process better when it's actively engaged on their own versus the passive, us providing it to them. So a lot of times when we're providing more of that passive motion, that's when kids can become dysregulated if you're not paying attention and watching what's happening to their system. Because they
That
are
is so interesting. And so that explains why the driver doesn't get car sick, but the pass does, maybe?
Correct, because you're driving, you're holding onto the steering wheel, so you're getting some additional tactile and proprioceptive input as the driver. And I don't know if you're one of those passengers that is very sort of reactive to things that are going on. When you're a driver, that doesn't happen because you have that additional input. When you're the passenger, you don't have that, and you're constantly like reacting and annoying the driver.
Yeah.
Which also is who's driving.
Exactly.
So,
depends on
yes,
who's driving.
yes.
But as Pam said, the active is so much better, because if you're active and you're running around the room, you're inherently getting tactile and proprioceptive input along with the vestibular, as opposed to sitting on a swing and just being put through the motion.
So this is such a good point. And let me ask you this. So sensory diets are something that like people are told to do, especially in school. And like one of the things that I've always said, well, what if that's not what she wants at the time or what she needs at the time? So it has to be the person's choice in order for it to be regulating. Is that what I'm getting out of this, or is that not? Or just that it's more, it could be more dysregulating if it's not their choice. Like it's harder for the other person to regulate the amount of input you're giving.
Yeah, definitely.
I'm complicating
I
this too
feel
much.
that, I definitely feel it can be the child's choice. Again, depending on the age of the child, you may set it up differently. So when I'm thinking about a sensory diet, there's a number of different activities that might be sort of on that diet menu, because you really don't know like what
Yeah.
that child needs. Maybe one morning, after a bad night's sleep, maybe it's vestibular input that she needs when she's coming into school. Maybe the next day it's proprioceptive. So there has to be a variety of activities that would be targeted to, once we understand, the child and how they're reacting and what they respond to, sort of set up, and almost within a choice, so, do you have sort of like an activity, a corner where you have some options that you're seeing that the child's dysregulated, let's go over to our sensory area and let's see what they migrate toward at that moment in time. And that may just be it.
Yeah.
I think the other thing you have to know is that there are a lot of times we have to start passively because the kids don't know and they can't tell, like they aren't seeking the right information. So we do start off oftentimes passively, but it's not that we're just like pushing a swing randomly, not paying attention. You're trying to get pieces of engagement. You're stopping the swing. You're changing direction. You're changing an intensity, because through our training, we've all learned what is calming, what's arousing, what the different movements of the swing will do. So through our training, it's not just putting a kid on a swing.
Right.
Yeah, and it's not just like every morning, when this child comes in the door, they go sit and bounce on the ball.
Right.
That may work during some times of the day, but it might not work at that moment in time. So again, it's being able to understand, what's happening and being able to sit back and watch, so that we can understand a little bit more, and then, kind of partnering and collaborating to kind of figure out what's going to be the best inputs, what's going to help you calm.
Yeah. Okay. That was super informative.
I think that brings up a good point too. And I think one of the points is that if your OT has given you a subset of sensory diet activities, keep talking to them about it. Keep asking lots of why questions, because learning about how the sensory system works really is a vast thing to learn. So I think it's important to lay a little bit of a foundation when you're working with families as OTs, and we're setting up these sensory diet activities, and keep asking lots of why questions in terms of helping your own self learn more of the nuances of what the OT was thinking while they picked these activities. And then you're going to get a better understanding of it. So then you can say, oh, I see this, so I'm going to do that. Or, oh, look, the child's responding in this way, so now I'm going to think of the next step. So it's our job to, help the families understand it as best as possible, and to have that happen over like the continuum of working with them.
Yeah.
But we love questions, and we love to explain why we're doing what we're doing. So ask.
Yeah, I love that about your profession. Okay, so we have another great question from Mary Claire Kovacic. They say, I'm curious about your thoughts about vision impairments such as amblyopia, impaired binocular vision, tracking, scanning, etc. on regulation.
So often, well, I guess
Right, it's getting dark.
we don't often see a lot of these types of things. Well, that's not entirely true. The frustration of not being able to understand the world through our vision system and getting misinformation from our eyes can definitely be dysregulating. It also really is frustrating for the child when they're starting to get involved in a lot of the cognitive and the pre-academic tasks, the drawing, the writing, and the reading. So it's really important to work in combination with your teachers and occupational therapists, physicians, and ophthalmologists, optometrists, neuro-ophthalmologists, developmental optometrists, to really get a clear package of what's happening with your child's vision, and then addressing all of those underlying factors in that same sort of detective way. But if your child is experiencing that range of difficulties, I would say speak with your physicians and seek out occupational therapy, because we could definitely help in those areas.
Yeah. And one other thing I'll just add here as like a little anecdote is another thing that's very common in autistic people is prosopagnosia, which is face blindness. And I don't know the exact percentage, but a lot of people actually experience this where it's difficult to differentiate between people. And so if you even just think about that from a visual perspective and the security that we get from being able to differentiate between who people are, that could probably be pretty stressful as well if you're in a busy environment and you can't easily tell who is who. So, this was something that I learned about through OTs that I worked with and ophthalmologists that I worked with. And so I just echo everything you say, Gina, about, getting help from people like you.
Yeah, I mean, one of the key things, that you could even, sort of look at yourself is very early on in infancy, do we have the ability to keep our eyes focused on an object? So at 4 and 6 months old, we really start to use our visual system well and our ocular motor system well. So, at 6 months, we're following a toy back and forth. We're following a toy in a circular motion. So, if keeping eyes focused and following things with our eyes is hard, then it's definitely an area that it would be helpful to seek out some OT for.
Yeah. Okay, so we have another question. I think this is Dr. Spivak from Rutgers Dental School. So he says, my patients have severe problems with oral defensiveness. They don't even let a parent into the mouth. Any suggestions, any specific therapist to refer to? Joanne, it looks like you want to say something.
Yeah, well, yeah, we see a lot of kids that do have some oral defensiveness, some oral praxis. A lot of times we see them coming through with feeding disorders, but we do get a fair amount of kids where the complaint is, I can't brush their teeth, I can't do any kind of oral hygiene. And definitely we can work on activities to be able to start to desensitize that oral area, work outside of the mouth first, then work inside the mouth, and activities, that the child is going to be engaged in as well. So, looking at some tactile input, looking at some active, blowing, sucking activities and things where they're going to be able to use their mouth and they're going to be able to get that input, similar to what we would kind of do with our whole body in terms of having that active engagement. A lot of doing that with our oral motor skills, and then getting that oral tactile input in there is a lot of active engagement too.
Maybe could Patty or Gina maybe add here, because I think another thing that isn't maybe as known in like other fields is the motor piece is huge when it comes to oral. And, you know, a lot of kids can't even necessarily open their mouth on command. They may not be able to coordinate swallowing if their mouth is open. You know, chewing may be very tedious. So could you like tell us about some of those impacts and like what signs would you see and like what should people know about that, because it impacts not only oral health but feeding and swallowing and, you know, everything that goes with that.
Right, so that's it's pretty common. A lot of your kiddos that come in, especially picky eaters, one of the first things you really should look at is what's going on with the mouth. I just recently had a 4-year-old come in, and mom, her thing was that she's such a picky eater, all she eats is crunchy foods. And when I had mom try to do some oral motor tongue movements, the poor girl had absolutely no ability to imitate anything that the tongue was doing. And understanding how scary that must be for the little girl, that she can't manage new foods. I know how to make these crunchy foods go down. I can't make my tongue move and clear any other foods. I can't make my tongue clean off the roof of my mouth. So that becomes very scary to kids very early on. So a lot of the kids with picky eating, we really need to clean up that oral motor system first. And it increases anxiety when they can't do these things and they see other people doing it. And people are saying, come on, just chew or just do this. And they can't. It's really hard. So really working that oral motor is really important to have a progression of foods. You can't expect someone to take something new and they're not going to know how to manage it. It's scary to choke or to not have something go down well. That's where we increase those anxieties.
I think that's such a key point when it comes to this whole idea of motor planning. And I think that we should explain this a little bit.
Yeah.
So we use some fancy words in OT and sensory integration. Motor planning really means I take in sensation from the environment through all of those senses that we talked about, our touch system, our proprioceptive system, vestibular, and we make some sort of motor output. The motor output could be walking, it could be biting, it could be using our hands to pick up a pencil, and then it gets more complicated than that. So we also use this fancy word called praxis, and motor planning and praxis pretty much means the same thing. But there's some more steps to it. When we use the word praxis, we create the idea of what we're going to do. We get the information into our body through our senses. We go ahead and do something, and then we adjust things. We get more sensory feedback and we try again and we adjust things a little bit. And our hands and our mouth require the most finest of adjustments. And it's the hardest and movements that we have in our body is hands and mouth. And the subtleties and the nuances of understanding the complexity of that movement is really, really important. And so often it's sort of labeled as the kid won't.
Mm-hmm.
It's very, very, it's never, but the kid won't. It's, I have no idea how. I can't do that little nuance that you're asking me to do. I can't create the idea, never mind adjust it. So really paying attention and working with your therapist to break down that understanding of praxis as it relates to that individual person's needs is really, really, really important. And there's also the piece of anticipating what's going to come next so that they really get to the point where they could create on their own what their body needs to do that do that task. And that whole process is fairly complicated, and is sort of the baseline for what we do as OTs when we're using the sensory integration model and helping the individual get their sensory systems to perceive that information, and then be able to create lots of ideas on how to move their body, and then be able to do that in lots of different demands and lots of different environments. And that is one of the cruxes of what OT and sensory integration brings to the table, and can, facilitate and help the family learn all the nuances of that, so that we could step by step build that into the child's ability to have ideas and complex motor movements.
Yeah, I think that's such a great point. And just to piggyback on that, Gina, is that the other piece is that for a lot of kids, these abilities are very unreliable. And, maybe one day, especially if they're working toward a motor plan or, something of that nature, maybe one day they can do it, maybe the next they can't. And again, it's not because they won't, it's because it's very difficult. And, it's good for us to all remember those things, because even the anxiety that would cause in knowing that you can't rely on your own body and people think that you're just being difficult, it must be really tough.
Right.
So,
And when you think about it, no day and no moment is exactly the same as it was previously. So,
yeah,
the kiddo may have learned how to do this, and one point in time and their body was receiving these sensations, and their arousal was optimal and the lighting was great and the noise
right.
level was good. And then the next day they're asked to do the same thing, and maybe it's raining outside and maybe it's colder, so now they've got to respond to a whole different set of things that are happening in their environment that are impacting their body, and
Yeah.
they haven't figured out how to do it. They don't know how to do it.
Yeah.
Yeah, that's often I try to explain in the beginning. It's super, a little super scary when you originally get an autism diagnosis, and you're looking at, the way your child interacts with the world. And I often describe it as a picture book or an album. So often, based on that experience that Joanne just described, the subset of experiences were just right. And there was sort of like a picture taken, and that's sort of embedded in them.
Mhm.
And then in order to do it again and again, the picture has to be the same. So often, as other people in the world, we get a little frustrated with that. And, we say, the child has a rigid way of engaging with the environment, or, they like to do things their own way, or whatever words we use to describe it. And really, that's the only way they could anticipate and do and motor plan.
Mhm.
Their bodies need more opportunity for their nervous system to develop. And that again is so they may or may not have lots of pictures. They may start with a subset of pictures that they sort of have these motor plans in. And what we hope to do in OT is generate more and more really good sensory motor experiences that they are, that are somewhat child directed. We're following their lead, they're following our lead, and we're building on that. And within that experience, their nervous system gains more information. They get the opportunity to do more motor outputs, and they make more and more and more and more pictures, so that they have more information to create more of these motor plans off of. I guess that's what I'm trying to do, is explain sort of that background in terms of what OT is looking to do using our sensory gyms and our sensory, environments.
Yeah. Yeah. I mean, this is really like what it's all about. It's trying to help a person who's already adapting to nervous system differences and, seeing what their needs are so that you can just help them, to feel better and to be able to have agency. Can I just ask, Dr. Spivak had said, back to the patients, any predictors for success with patients with the major oral defensiveness? I'm not really, I'm not sure. I'll just give a personal anecdote and then you guys tell me your professional opinions. But I know like a lot of kids that I've read about, having practice and not being rushed and feeling safe and doing baby steps has seemed to be something that helps. I know that that's really difficult, like in a dental office environment. And so I don't know
Yeah.
I don't know what the magic key is for that. But
Yeah, we have a particular dentist in our Toms River area who specializes in this, and they sort of set aside a time frame, and they step by step the whole visit. So the families have the opportunity to bring their children and just come sit in the chair for the first time. They
Mhm.
don't do much else. They just sort of explore the environment, sit in the chair, hang out for a little while, go home. And then, the next time they come in, I think maybe the dentist gives them, the families, some information, and they practice some things at home. And even, like you said, Jen, practicing opening your mouth on command
Mhm.
is a big thing, to practice. And then, opening your mouth on command, and then, touching something to your teeth. And again, lots of mirroring, and maybe even taking turns, oh, mommy's turn,
Mhm.
Susie's turn, these little things, could help. Um, but if the child just isn't really ready for all of that yet, it may be a good idea to work with an outpatient occupational therapist to build the steps up to it and really help with some of the underlying factors before the visit.
Yeah. Okay. Okay, we have another question from Nancy Ann. My son suddenly developed so much tantrums. It's not seeking attention in the midst of a happy play. He can suddenly roll on the floor crying, stomping, etc., even in the midst of getting up in the morning. What say you?
It's hard to know. There's so many factors that could be going into it. Did something change in the house? Even something as simple as fabric softener. Did the weather change? Is he getting headaches? There's so many underlying factors that could be going into it. It's hard to make a blanket statement.
And is it the stress from our current situation related to COVID?
Yeah.
Entire lives are changed and upside down, and routines are changed. And we are seeing a lot of kiddos that are having big stress responses and big anxiety, just related to the state of the world right now.
Yeah.
Hormone changes. How old was the child?
Nancy Ann, are you still there, Nancy Ann? Tell us his age if you would like to.
So even hormone
yeah.
changes sometimes, like chemical imbalances, can cause kids to just out of nowhere start having dysregulation, tantrums, more problems.
There's actually another thing, and I don't know if this is technically motor related, so tell me what you think, but I've read articles from autistic people, and a lot of people commented agreeing that they experience the same thing, where it's like a loop of an emotion.
Yeah.
Is that is that a motor thing? Is that cognitive? Like, what is that?
So I think a couple things even before we talk about that part of it. any tantrum is sort of that overwhelm response. So for whatever reason, there is something, it seems, internal, going on. We
Mhm.
may be able to predict it, we may not. So thinking through to any sort of, tantrum management, if we're looking at it from more of a sensory experience, first of all, if of course, it's always, difficult when you're trying to get out the door in the morning and the tantrum comes, or you need to do X, Y, or Z. But change what's happening in the environment to eliminate as much of sensation input as possible. So stop talking,
Mhm. Yeah.
turn off the lights, turn off the TV, remove as much of the information as possible, and just sort of, wait it out. And that's sort of like tantrum management 101. The biggest thing that I will say, and I say it over and over again, stop talking. Don't ask him why he's having the tantrum. Don't place another demand. Don't ask a question. Just stop talking. Let him be, walk away. Just allow enough time, because the way the sensory system works, the way the nervous system works, is once you get to that tantrum response, only time is going to allow it to go away. So
Mhm.
nothing really at that point we could do to make it, too much shorter, except for eliminate any other inputs that might be, going in that direction. It's hard when you don't have the time to allow it to run its course. That's when it gets to be a little bit of a sticky wicket. But again, I'm going to say it, don't talk. Let it be, allow it to run its course, and then try to do the detective work to try to understand, the whys and whatnot, and then put those pieces into place to try to be preventative if you can.
Mhm.
But what else did you say, Jen?
About the emotional loops.
Oh, right. So what we very often see with a lot of the kids that we work with a variety of different diagnoses is they do get sort of stuck in a emotional pattern, a cognitive pattern, or a motor pattern. Even the point of, some of the, little stims and stuff that happen are really a, sort of motor loop that goes on. And so again, sometimes eliminating all of the added stressors or added sensory input can help, but often being very practical and asking them to do something else, or providing an opportunity for their body to do something else that's very normal for them, helps to break that, to break that, like to the simple point of, oh, can you throw this in the garbage for me? Allows them to be like, their brain then sends the motor pattern to go do something else, sometimes helps, to break that loop. Lots and lots of sort of practical distractions. Oh, what's your favorite story? Or even asking questions. Oh, what color is that over there? What color is that over there? What's your brother's name? Or can you get me any practical thing that your child is able to do that you could distract them off of? Simple, short and sweet sometimes does the trick.
Okay, cool. Okay, I think those were the community questions we have. Let me see if I had anything else here that we didn't cover. Maybe just if we could just talk about one other area, which is as kids are getting older in, middle school, high school, you know, that's kind of the time where we start thinking about transition and you know, trying to find things that maybe they would be interested in employment after they graduate and things like that. So I know this is an area that you are all exploring now, and maybe you could just tell us how can OTs or what's your vision for how OTs can be involved in this transition process, and just we know that this is an area of need. So what do you got for us?
There's so many areas where OT can be involved in this, you know, just from basics when you're looking at, you know, carrying out just daily activities for yourself, you know, looking at the activities of daily living, and are they successful with being able to do dressing, bathing, hygiene, because they're going out into the community and they're going to school. And then going into that next level of it, which we call the instrumental activities of daily living. You know, can they, you know, walk down the store corner to the store? Can they manage money on a simple, you know, on a simple level? Can they prepare a simple meal for themselves? So, you know, even starting with sort of some of those basic, you know, skills that you want to do, you know, for yourself, and then, you know, a step back with that is huge, in terms of looking at some transition and some life skills, and then even looking at, you know, interests, you know, where are strengths, you know, where are interests, and how can we capitalize on this, and, you know, help sort of guide and facilitate a direction that's going to be really meaningful, you know, as kids and parents, you know, start to think about, you know, what's going to happen after high school and, you know, moving in. So there's
Yeah.
so many areas.
Do you think one of the keys is not waiting until our kids are about to graduate?
Yeah, definitely is one of the things. I think another thing for OT, we are really good at task analyzing, breaking down tasks and trying to get the underlying factors of what's impacting those tasks from happening.
Mhm.
And that's really what we do. And that's really what's needed for transitions, to figure out why is somebody having a difficulty managing their time, being able to get to the bus on time, or figuring out a map, or whatever needs to be done. OT, we really do look at everything surrounding that one task. It's not just a task. There's so many compartments to that. And that's what we really do. I think there used to be more OTs as job coaches years ago.
Okay.
And that seems to have made some kind of shift. But that's really where to break down and be able to guide employers and other people, teachers that are working with these students, young adults, where they can be helpful. Earplugs, like what's needed to be successful in each of these environments. That's where we can come in and really make a difference for people.
Oh, exactly. And even just, you know, as Patty said, going down to that task analysis and the environment, you know, we can go into that workplace environment and, you know, look at what are the sensory aspects of this, you know, what are the things that are inhibiting, and what are the things that are great about this environment, you know, whether it's from the lighting and how it smells, and, you know, the floor, and, you know, even the feel of the furniture. And yeah, we can really get in there and help analyze all aspects of that.
That's wonderful. Anything else you wanted to add, Gina?
No, I think they hit it right on the head.
Okay, perfect. Well, okay, so this will be available for anyone to rewatch. If you have any other questions for our OTs, you can still feel free to email us, and you know, we can absolutely relay them. You can find Gina, Joanne, and Patty at Children's Specialized Hospital. We're so grateful to the three of you for being here and answering all of our questions. And thank you for the amazing work that you all do. And I just want to remind everybody that coming up on April 29th, we have our next webinar, which is Communication Access is Fundamental with Communication First. So with that, I apologize for my lighting, and I hope everybody has a great evening.
Thanks.